plague, influenza, Ebola. The most contagious and deadly diseases in the world could be on our doorstep overnight. Would we recognize the symptoms? Can we treat the disease or even keep it from spreading? The margin of error?
Stop!
0. At stake for the medical team, their own lives, the safety of their families, and the community where they live. An elite group at a Nebraska hospital faced the real thing. This was not a drill. The lessons learned treating 3 different patients with Ebola reshaped high-risk emergency medicine nationwide. The crisis passed, but a question remains. Are we ready for what comes after Ebola?
Nature is experimenting 24 hours a day, 7 days a week, 365 days a year. So it's a little bit of a Frankenstein-type picture that nature runs continuously. And we're never sure what the new bug is going to be. We have to be prepared for that.
Do an internet search for recent news coverage of pandemic or infectious disease, and you will find recent stories about a high-risk outbreak somewhere in the world. Science can identify a virus quickly, but the world remains vulnerable. Avian flu, smallpox, cholera, new strains of tuberculosis.
I don't need to point to some hypothetical disease in the future. I'll point to Zika and say we're not ready. Clearly we're not ready.
So, before the patient gets here, we need to have...
There's a lot of work that needs to happen in hospitals and in public health departments to make sure we are ready for the next pandemic.
Then came Ebola. A unique set of circumstances gave the University of Nebraska Medical Center the extraordinary opportunity to encounter face-to-face patients infected with one of the world's most frightening and highly infectious diseases. This became, in a sense, a dress rehearsal for the worst-case scenario.
What do you think we'll get? What would be the first one we'll get if we get one, or which one would you rather get? And somebody piped up and said, I really hope we don't get Ebola, because that's the worst of the worst.
When you're docking, the only things that you take off yourself are your gloves and your respiratory protection.
A special unit on the campus of the University of Nebraska Medical Center spent 10 years preparing for patients with dangerous, highly contagious diseases.
This is the deadliest outbreak of Ebola on record.
Ebola infections will double every 3 weeks.
In a city of 1 million, almost 50 new cases are reported every day.
In 2014, the Ebola virus swept through West Africa. More than 11,000 people died in Guinea, Sierra Leone, Liberia, and Nigeria.
Crisis meeting to discuss the Ebola outbreak.
This Ebola thing is not under control. We are not being told the truth.
Most of those who get it will die through uncontrollable...
Without a doubt, people are afraid. If you look at Ebola, there's no treatment, there's no vaccine for the most part. That's a scary situation.
By late summer, the United States government felt Americans infected with the hemorrhagic fever should be brought to this country for medical care. Emory University in Atlanta received the first Ebola patients ever treated in the U.S. At the time, only 3 hospitals in America had facilities able to safely contain and treat the disease. Emory, the National Institute of Health in Washington, D.C., and the Nebraska Biocontainment Unit.
Hey, good afternoon, everybody. We are following breaking news of national import in Omaha at this hour.
We are live at the Nebraska Medical Center. Doctors are holding a news conference to discuss an American doctor with the Ebola virus coming to the Nebraska Medical Center.
Well, I'll never forget, I was walking down the hallway with Angela Hewlett, the associate medical director, and my phone goes off. It said State Department. I thought, here we go. And they said, we like your unit. In fact, we like it so much that we're going to send an Ebola patient to you.
And we started saying, well, what do we need to do now? And it involved a very quick array of phone calls and talking with the health department and the rest of the biocontainment unit leadership team.
The Nebraska Isolation Unit was a creation of the University of Nebraska, the privately managed hospital, Nebraska Medicine, and the state's Department of Health and Human Services.
We say that for activation, it's kind of like a safety deposit box. You need 2 keys, the state health department and the hospital.
State health officials agreed it was time to open the unit to accept its first patient.
It was a little bit surreal, but more than a little intimidating, I think. And it was definitely invigorating in the sense that I think our team said, okay, we're activating, we're going to do this work, we're going to work through this problem, and that's exactly what happened.